In the field of the newly diagnosed multiple myeloma, transplant-ineligible, usually patients older than 65 and up to 80, potentially 80 plus years old, there has been this year in 2024 a new definition of a new standard of care, which is groundbreaking, a quadruplet-based regimen based on a couple of studies, couple of Phase III studies, 2 of them for registration, and one study that I'm talking about now is IMROZ. So as you pointed out, as you just said, IMROZ is a comparison, 1-to-1, between 2 regimens, an old standard of care, HRQoL, Bortezomib, Lenalidomide, Dexamethasone, and a new standard of care, the quadruplet-based regimen. The real novelty here, where you take the same control arm, the backbone, HRQoL, and you add a monoclonal CD38 monoclonal antibody. The quadruplet-based regimen in the original data presented at ASCO, in the EHA 2024, published now in New England Medicine in June 2024, demonstrated how incredible was the quadruplet, not only better, but so much better. Based on the primary endpoint, the PFS, with an hazard ratio 0.59, and a control arm that performed incredibly well, 54 months, almost 10 to 12 months better than we used to, and with this hazard ratio, an expectation of the experimental arm PFS median around 80 or 90 months, almost what we were used to get 5-10 years ago in the transplant setting, though now here we are in the non-transplant setting. The second, probably most interesting, most important data was the MRD negativity rate, the sustained MRD negativity rate at 10 to minus 5, 10 to minus 6. All of these data were so incredibly increased. The control arm was about 40%, and the studied arm was almost at 60%, a 20% increase. Again, incredible. Now, what's very important is that when you, and what's important for the patients, their families, and for all the people that are going to use that regimen, that quadruplet-based regimen, is that the patients are going to do good. They're going to survive for a very long period of time. So we are going to have to learn how to give it safely to the patients. And it's not like giving a drug for 1 year. You're talking about giving a drug for almost 8 to 10 years. And you're talking about giving 4 drugs, then at some point 2 drugs for 8 to 10 years. And so it's very important to look deeply into the safety profile and the quality of life of the patients, so to make sure that if they survive with myeloma, but then they survive with a good quality of life and they're happy surviving with myeloma. And so the sponsor Sanofi has been doing an analysis of the quality of life in IMROZ to make sure to look into whether the patients that are going to be the longest on treatment because they survive longer, because their regimen is much better, are going to benefit from that treatment, not only in terms of disease control, but also in terms of quality of life. So the IMROZ study reported after 5 years follow-up, which is a very long follow-up. Usually the studies report after 2 or 3 years. Now here it's 5 years median follow-up, reported that the quality of life of the patients on the quadruplet-based regimen was absolutely superimposable to the triplet-based regimen. So this is very interesting because it tells that the addition of the CD38 monoclonal antibody Isatuximab actually improved the chance for the patient to survive and never compromised their quality of life, the rate of side effect, the severity of the side effects, and how the side effect could pollute, impair the quality of life. So it's very reassuring. It shows the regimen is safe. It should, I believe, encourage every colleague to propose the treatment to their patients.